This is just a temporary dip, and we'll continue to see a rise in the number of cases. So at the moment, we still are fairly tight in the intensive care unit, essentially full in terms of staff beds. We're at about 80% capacity for our beds outside of the intensive care unit, in the COVID units and on the floors.
And how many COVID patients are there, and how many of those are in intensive care?
We have, I think, 9 intensive care unit COVID patients as of today. We have roughly 70 patients in the hospital today with COVID.
What is the situation with your ICU? What's the capacity? Where are you at? And what do you guys really need to kind of ask for these extra resources?
So we have been really dancing around essentially 100% full in terms of the number of beds that we can staff. We've had a few available physical beds in the intensive care unit. As of day before yesterday, we were down even to 3 beds total that we even had available in the intensive care unit. Our biggest challenge has clearly been in being able to staff the beds that we have. So we have available bed space within the hospital that we would like to be able to care for more COVID patients here in our hospital. But we've had a terrible problem trying to get enough staff to be able to have nurses, assistants, respiratory therapists, and so on to be able to care for those patients. And normally we're able to reach outside of the valley to traveling nurses, to temporary nurses, per diem nurses, and staff to fill those positions. But because of the nationwide nature of what we're dealing with, the agencies that we normally turn to are basically tapped out. There really are not a lot of resources out there to staff additional beds. So we turned to the county of Riverside and asked if they had any resources that we could potentially tap into. And through them, we were connected with the Department of Defense that's providing the team that's arriving at our hospital today.
And we're assuming now you know a little more about the team. How many are in the team? What positions are there? And are they going to strictly work on COVID patients?
So we are going to really be meeting the actual team themselves for the first time literally minutes from now. They're arriving as we speak, and we will be sitting down with them to really hammer out final plans. Our preliminary plan, as we understand it, there are 21 people on the team, 3 or 4 physicians, a physician extender, probably a physician assistant. We have some respiratory technicians, and the bulk of the rest are nurses, some ICU nurses, some floor nurses. Our game plan is to try to deploy them for the most part in dealing with the COVID patients. So we have COVID isolation units. We initially are planning on having them help man those units so that they're really getting right into the trenches, helping us with the patients that are really needing the most attention right now and have been putting the most strain on our staff because of the highly physical and emotional nature of taking care of these very ill patients.
You talk about that strain on staff. How have you been able to deal with that at such a high level of capacity? Have you had people on double shifts, 7 days a week, that kind of thing?
Right. We've been able to work with our staff. There have been some extra shifts that people are taking, but we've been very, very careful about the fact that we don't want people taking a lot of extra shifts, getting themselves physically exhausted, because then they're at risk for getting sick. And they're so critical to us. If we lose nurses, if we lose respiratory therapists because they become ill, because they become injured by overworking, then that really impacts our ability to continue to function. So we've tried very hard to balance the need for additional staffing with being sure that our staff isn't overwhelmed completely. And that's again where we turn to people like the County of Riverside to really help us with additional resources.
And how many doctors or nurses have gotten sick with COVID themselves here?
Fortunately, we're still at a relatively low number. I don't have an exact number for you right now in terms of the total number that have been infected. But our staff are members of the community, just like everyone else. And so they're exposed to this disease outside of the hospital. Certainly, at least through all the earlier phases, we were really quite confident no one was getting the disease within the hospital, because we are very careful about being sure that we're providing all the proper protective equipment for the staff and for the patients to try to reduce the risk of any in-hospital spread of the disease. Now that it's become more endemic, though, in the community, we're seeing more people sporadically, not large outbreaks in any given unit, not specifically on the COVID unit, for example, but just sporadically around the hospital of people that are showing up with COVID infections. And we believe the majority of those are happening in the community, but then they bring it potentially into the hospital. We're testing 100% of the admissions to the hospital to be sure that we believe, at least at that moment in time, that there's no evidence that they are infected when they're admitted to the hospital. But it's very impractical and difficult for us to really test the staff on an ongoing basis. We can test them periodically as needed, but testing them every day, for example, obviously would be impossible given the constraints we have right now on testing.
If the hospital reaches capacity, what's next, doctor? Would you consider a tent unit?
So right at the moment, again, fortunately, our capacity issues are really staffing issues. We have space within the hospital, even at this point, within licensed bed space. As we go deeper into our surge planning, we do have additional areas within the greater area of the hospital, either in the hospital building itself or in adjoining buildings, that we could potentially house patients in those areas. Because of the heat out here in the desert, it's very difficult to really talk about using tents in a practical way. It's hard to air condition those when you're talking about a large number of people inside the tent, equipment and so on, very, very impractical. So until we really get to the end stages of our surge plan, we're really trying to look at, are there alternative spaces, such as our old cafeteria space, for example, not a patient care area traditionally, but an area that we could potentially partition off and create a tent-like structure there, but within the confines of the hospital itself. Yeah, so I know that the other hospitals in town are really in the same boat that we are in. Everyone is really basically pretty much at capacity right now. They have, they're for-profit organizations that flank us on both ends of the valley, that have some corporate backing, are able to potentially mobilize some staffing from other parts of the country and so on. So they have a little different solution than we do. They have a number of traveling nurses that are arriving to try to help bolster their staffing issues. But we have the same staffing issues across the valley. And the other concern, as we talked about, what do we do as numbers surge, is that, again, a normal relief valve would be you'd look outside of the community, outside of the valley, to transfer patients if need be. But everyone in Southern California, for certain, and really across the entire desert Southwest, if not the majority of the country, are really in the same situation. So the reality of really being able to effectively transfer patients from here in mass to other institutions is very, very limited. We've even struggled in cases where we've had to send patients out of the valley for very specific types of treatments that are not available here for us. Those institutions, you know, are very happy to try to help and try to provide those services, but in some cases they're unable to because they too have no intensive care unit beds.
And what's the buzz like among staff here, knowing that, you know, this group of 20 people are close are coming and they're going to get some relief? What are they saying? How excited are they? And just in general?
Yeah, they're saying, yay. They are very happy that this group is here. And I know that 20 people may not seem like a large number of people, and compared to our overall staffing in the hospital, I suppose it's not a huge number. But these are people that are going to be able to target critical needs that we have, and that's going to give our staff a breather for a little bit to just get a chance to step back, recharge a little bit so that they can be ready to come at it again, as well as potentially open additional capacity. So as we went around with the advanced team from the Department of Defense yesterday, and we gave them a bit of a tour of the hospital, staff member, you know, really walked right up to them, right up to us, and said, "Thank you so much for coming. We're so happy to see you arrive." So there's it is a great relief to know that there is help from outside, that there is support outside of our valley when we really need it. Yeah, at this point, from a ventilator and personal protective equipment standpoint, we're really doing reasonably well. We're never completely comfortable with that since we don't know where we're going for sure. We have our forecast, but obviously time will tell. Our challenge right now is really staffing more than even bed capacity. In the intensive care unit, as of today, I've been so busy this morning I haven't had a chance to even look at our numbers for today, but as of yesterday, I think we had 4 or 5 beds potentially available in the ICU, again, as far as physical space goes, but not really staffed to take care of those patients as of yet. So hopefully by Saturday, after we've done some orientation with this group and trained them on our protocols and our computer electronic medical record system, they're going to be hitting the road running on Saturday, and we can open up that additional capacity in the ICU.
And then compared to like the beginning of the pandemic to now, that difference that you're seeing, and also the death rate is something we don't talk about, because people go, oh yeah, it's just the flu, and if they go in, it's just for a couple days and they're fine. So give us a little insight on that.
So our experience here at Eisenhower was an early surge. We were one of the first hospitals in Southern California. We were the first hospital in Riverside County to see patients with COVID. And then we saw it progressively increase in terms of the number of cases until we got into the high 20s. And then through a lot of effort, through the press and others really getting out there and delivering the message how important and how critical it was with our patient population, who on average are at higher risk than many other communities because of the average age of the population, and in particular in the early phases of the disease where we were seeing a lot of elderly patients being involved. We got the word out there to do the social distancing, to stay at home, to wear your masks and so on, and I think people really did take that to heart. And we saw the numbers plateau, and we literally for about 6 weeks we're really seeing basically a very steady plateau, not a major drop until the latter part of that. We finally started to drop back down into the teens. But we were at least plateaued. Then end of May, early June, after Memorial Day, we just really saw the numbers again go out of control and become exponential in terms of the increased rate of cases that we're seeing. The other change that we're seeing is a shift now towards an overall decrease in the age of the patients that are infected. So if we look at average age, it is a bit lower than it was early in the pandemic here in the Valley. But unfortunately, the reason behind that is because we're seeing entire families that are infected. So we see 18 and 20-year-olds, but their 40-something-year-old parents and their 70-odd-year-old grandparents are also infected. Some may be able to be at home. Others are hospitalized as well. So it unfortunately does not give me a lot of positive feelings to see younger people infected, because it really just means it's spreading through the whole community and infecting everyone.
Do we have any questions for Director Martin?
So Bruce Martin is the Director of our Emergency Management Department. He's also the EOC, Emergency Operations Center Director. He's been intimately involved in the day-to-day operation from a county response basically since January.
And the people who got the team here, so you do need to talk to them.
Thank you, Doctor.
All right, thank you.
Hi, good afternoon. So if you have any questions for me, my name is Bruce Barton, last name spelling B-A-R-T-O-N. I am the Director of Emergency Management for the County of Riverside, and also currently serving as the Director of the county's Emergency Operations Center. If you'd like, I could start off with the process of how this team ended up getting here today. And I think that'll tie into the surge planning discussion that you just had with Dr. Williamson. So as part of that surge planning initiative, which has actually been going on for over a decade and a half in Riverside County, thanks to state and federal funding to be able to do that. So we closely plan all the time for emergencies and disasters with our hospitals. Within that planning effort, every hospital develops a surge plan, and that ties into the county's overall emergency medical services surge plan. So a piece of that surge plan is when it gets to the point where all the hospitals have to enact those, basically need three things. They need the space, they need the equipment, and they need the staffing. And so the space they develop, and we also have additional space that we've developed through this emergency, the two federal medical stations, that we have up that remain in place. They're in a warm condition right now, and we are able to stand those up. We've kept the wraparound services to keep it operational in place. So we are really focused on supporting the hospitals and their internal capacity for their own surge plans at this particular point. So like I said, it's space, it's equipment. If they need equipment, they are pushing that up to the Riverside County Emergency Operations Center, where we are looking at, okay, do we have that in our warehouse? We keep a very large warehouse as part of our surge planning initiative in the county. That's where all the PPE is. If hospitals need personal protective equipment or our first responders need it and they can't get it on their own, they push that up, we meet that request. We're also working with the hospitals on any durable medical equipment that they may need. And the County of Riverside is committed to supporting our hospitals with the CARES funding that the Riverside County has received. The third piece is staffing, and that's really where we are, and that's the big challenge in Riverside County right now. It's not the space, it's not the equipment, it's really the staffing. And all of the hospitals right now are struggling with staffing. We have been at this response for 5 months now. Some of us longer, some of us since January 28th when we got word that that aircraft was first going to come into Riverside County. So as they have been working for long periods of time, obviously they're stressed, they're tired, and now we have this surge. If you look at what we have going on right now in Riverside County, we have about 550 COVID positive as of yesterday in our acute care hospitals, another 141 in our ICUs. So we do have the surge going on now that we contemplated and planned for back in March and April. So when a hospital is looking at staffing and how they're going to bolster and support their own staffing, they obviously go internal first, then they go to any contracts they have with registries or other staffing sources, and when those are tapped out, then they can push a resource request up to the Riverside County Emergency Operations Center. So that's what happened. Eisenhower reached out to us, said we need some additional help with staffing. We worked with them to get that resource request ready, and then what we do at the county EOC is we push that up to the State Operations Center. And the State Operations Center looks at that request, they look at what resources that they have available, and then they decide at the state level, based on that request, what the appropriate staff is to be able to send down. So the requesting process takes about 48 hours. It took about a week to mobilize the team. And they have arrived today. So the county continues to remain in support of the medical center and all of our hospitals throughout Riverside County. I can tell you that there is one other hospital that requested staffing and has received that staffing from the state. And there are 4 other hospitals in the county of Riverside that currently have resource requests that we're working through the system so that we can support them with their staffing. So that's kind of an overview of where we are right now.
Real quick, Chip, I know you have to go. Do you have any questions for Bruce before you leave?
Just how quickly was it from the request, counter request, to here on site?
So it worked through the system in about 48 hours, just a couple of days, and then they literally mobilized and got here in about a week.
It was about a week and 2 days?
Yeah, in that range.
Yeah, I just had to do a little stand in front of the camera. I don't have to talk right now.
Yeah.
So I'm not ignoring you.
Okay, yep, no worries.
What other hospitals requested staffing? What is the other hospital
So-
that received it? And,
So there are hospitals that are in the northwest zone of the county and the desert zone of the county. We look at our system as a whole and as regions as well. So we don't identify individual hospitals, but I'm happy to share with you what regions those hospitals that are requesting that staffing are from.
4 others?
Yeah, 4 others. Yeah, one additional that has received staffing, and 4 others that we're working through the process with right now. So it's a total of 6 that have actually requested.
and it'll all be military personnel, the same?
Like I said, we send the resource request up to the state, and then the state adjudicates that resource request, and they look at what they have as far as resources, and the state actually makes the assignment. So it could be California Health Corps, the volunteer program that the state is running, or it could be other state or federal assets such as what you saw arrive here today.
Talk a little about the surge that we're seeing, the numbers in the past couple of weeks.
So if you look at, if you want to draw a baseline on the surge we're experiencing, if you look at coming into June, we were running around 200 patients, COVID positive patients in all of our facilities. We were running an average of around 70 or 75 patients in our ICUs. So if you look at the numbers today, those have pretty much doubled. So since early June, that kind of gives you some context on where we are as far as the surge right now. So the hospitals are, once again, they're all focused on maintaining services to their communities, maintaining that standard of care. They are able to surge, and we are able to get them through the medical mutual aid resource requesting process that I described. We're able to get them the resources that they need if they can't get them on their own. So right now our system is able to meet the current demand.
I know early on you guys set up a hospital at the Indio Fairgrounds. If the rate keeps going at the rate it's going, what are the likelihoods that we'll have to use that area, and if it's still set up?
Yeah, so that's the federal medical station that has been set up at the Indio Fairgrounds. We did have it stood up in March, and we did use it and had some patients there at one point in time. So they're very low acuity patients that go into those facilities. Obviously, it's not a hospital environment. It's really more austere care. So they're really, really low acuity patients. That's not really the capacity that needs to be expanded at this point. What the hospitals are dealing with really is up at the higher acuity level and at the ICU level. So that facility getting stood up isn't necessarily going to help them. The second piece is if we do stand that up, we're going to have to staff it with medical personnel. And right now, our requests for the medical personnel to be able to run that federal medical station would directly compete with the requests that we're getting from the hospitals for state resources. And I'm sure everybody can see it's every hospital in every county, in across the state, and pretty much every state that is now starting to compete with all of these resources. So our plan right now is to support the hospitals to expand their internal capacity. Any request that we send up for mutual aid resources is going to be to meet that objective. And but we have kept the federal medical station. It's 125 bed capability. We've kept it in a warm status. We have the wraparound services there as far as HVAC and all of the power and everything we would need to stand it up. We would just need to get the staff, and then we could do that. Another thing that's worth mentioning is the hospitals also need to be able to offload. They need to be able to have that throughput. So we're spending a lot of time, and we have our skilled nursing facility outreach teams, our SOS teams that are going out to those skilled nursing facilities. We're making sure that any support they need, they can have. We have medical professionals, we have our EMS professionals, we have our behavioral health professionals in all those departments. We're getting outstanding support from American Medical Response. We're giving them PPE out there at those skilled nursing facilities, teaching them how to cohort patients if they need that assistance, as well as how to don and doff that PPE, and those healthcare providers in those subacute care facilities have also been at this for a very long time. That starts to take stress, starts to take its toll, the fear of COVID, am I going to get sick? So that's why we have our Department of Behavioral Health also assisting with services out there in the field. So through doing that, through strengthening, through making sure that we shore up that subacute care at our SNFs and our extended care facilities, we're keeping the door open so that our hospitals can offload the patients once they get better and are ready to leave the hospital.
I have one more question. The doubling rate right now in our county is about 23 days.
Yeah.
That's a really worrisome number. If it keeps doubling, what's the plan if there's no capacity at the hospital? If it keeps doubling at that rate, that's a very concerning number.
So I think our doubling rate peaked at around 35 days, and we are now, with the surge we're seeing and the number of cases, it is down to about 23 and a half. And with those cases is going to come a certain amount of hospitalizations. What we're seeing, though, is throughput, right? So one of the things we're hearing also from the hospitals is the length of stay is a little bit shorter. And I give the hospitals great credit in the treatment modalities that they've been able to utilize that's providing the care for patients that is shortening their length of stay so there continues to be that throughput. That, along with them implementing their surge plans, the preparations that have been made, we can meet the need, and we're confident that we can meet the expected need.
There's somebody who's not got COVID, but they're concerned about going to the hospital. How safe is the hospital?
The hospitals are very safe. So If you feel like you need emergency medical care, please don't delay calling 911. Please don't delay going to the hospital. There has been that component of fear in the population in not going to the hospital. We saw some historic low levels of 911 call volume and ED call volume, and we think it was a lot driven by that. Our EMS providers, from the time you call 911 in the field, they are already triaging if there's a potential for anyone to have COVID. They're asking those questions at dispatch. The EMS providers are trained. They're supplied with the PPE. If the patient can tolerate it, if they can medically tolerate it, they'll put a surgical mask on the patient as well as donning their own PPE. When they transport that patient to the hospitals have been really good about setting up areas where if it's a suspected COVID patient, they're entering one way, and if not, they're entering through another way. Inside the hospitals, they've set up places where they can take these patients in that are suspected, that are cohorted away from the rest of the population. So your risk of contracting COVID if you come to the hospital for a medical emergency is very, very low, and certainly does not warrant, fear of that certainly does not warrant you delaying seeking out emergency medical care if you need it.
There's still a lot of vacancy in the regular hospital spaces, COVID. There's still a lot of empty rooms where people aren't getting treatment for things they used to.
If you look at overall licensed capacity, we've been running about 70% of the licensed capacity. So it's that additional capacity that the hospitals are looking at those beds and transitioning to those higher acuity ICU beds. So there is still some capacity there, but once again, the limiting factor at this point in the response is the staffing at the hospitals. So normal capacity non-COVID times, that's where we would run 75, sometimes 80%. Non-COVID, we're a really, really busy system. Before, if you look at how coming into pre-COVID, you look at last year all the way up through March, ED visits in the county of Riverside. By month, we were running 15, 16, 17,000 ED visits across all of our whole system. Even now with the surge ED visits, they're running 11, 12,000 calls, or they're seeing 11 or 12,000 patients through the ED. So the volume still remains down. It's just it spikes, right? You have different times that it spikes. We know after we have weekends that we're going to have periods that spike.
And so knowing that, like at the beginning when we have nowhere near these numbers, they shut down like elective procedures, stuff like that. At what point does that happen again? Because these numbers hovering around 100% staff to patient ratio, all of the hospitals here in the Coachella Valley are at that point. At what point does that get implemented again?
So that's part of each hospital surge plan. The canceling or reducing of elective surgeries. As part of their surge plan, they are always keeping track of that internally, and they would pull the trigger on that as each hospital deems appropriate. You know, one of the challenges has been they did that, they were canceled for some period of time. Well, there's a certain number of those elective surgeries that if they go on long enough, they're no longer elective. They become something that can no longer be delayed. So I think the hospitals are doing an excellent job of triaging that component and making sure that they have internal triggers to be able to do that as appropriate. Yep. Yep.
Thank you so much.
All right.
You're welcome. Did anyone want one-on-one with Bruce? You're good? No. Perfect.
Thank you so much. It's nice to meet you in person.
Nice to meet you too. All right. Good to see you.
Bye. Good to see you.